I just dropped my phone. Whatever. Just trying to get through my house is like a minefield trying to get to my car. I mean, crap. Okay. Well, I just shattered the back of my phone. Yay! I think I know what's wrong with me. I think this is all related to a lupus flare-up, long-term lupus flare-up, and now I'm starting to go in either full system problems, or what was in my lower intestines is now all the way up into my throat. Good and bad. Maybe we'll figure out what kind of a virus it actually is. Maybe it's streptococcus all the way down to my lower intestines. Small intestines, that hurts. Maybe it's COVID that I had in April, I think, but nobody can prove. Maybe I didn't. Maybe it was all just lupus. Now I'm starting to have trouble swallowing. Here's the choice. Okay, I can do what my doctor said, and my doctor is actually a nurse practitioner. She's at her limits. When I started going to her, I was feeling fairly okay a while ago, like a long time ago. And now that I'm in this horrible lupus episode, I'm going to call it a lupus flare or a lupus storm, whatever. She's at her limit. And she's kind of said that. She's like, look, I think that we need to send you a specialist. And I'm sorry, but it takes a long time to get there. So all of these things are popping up. My thyroid now this week, the inflammation is now all the way down into my chest and into like my sternum. So that might all just be the same virus that was down in my small intestines is coming up. I mean, it very well could be. And how do you treat that? I mean, how would I treat that? If I was a doctor and I was a rheumatologist with all that I know, and I am sure there are new medications, but the last time I was treated for a lupus flare-up, it was antibiotics, probably IV antibiotics, and steroids. And it is awful. It's awful. I pray that they have some other treatment that they can give me. Now, let's see, what else can I say? Antibiotics are not good for your gut. They have a time and a place. So what's my choice? Do I stay at home and treat myself? It's not really intelligent. Do I go to the walk-in clinic like Mary told me to? Which is what I'm probably going to do. And I need to at least get tested for strep and run some more blood work. That's my opinion. And I believe that I'm going to get hit by a car. Just kidding. I'm paying very close attention. I'm working really hard on being a better driver. So I believe that I should go into this. The other choice was, do I just go to an ER? Do I go to downtown where my husband is, where they may do something, they may not, or I may catch something. So it's a sticky road when you have an autoimmune disease. You got to play it out and figure out who can help me the best, the fastest, who is going to believe me wherever I go, and compile all the information. There's really no answer to those two questions. That's why I treat myself. I'm here. See you in a bit. I'm sitting here gagging. We just did a strep test. So whatever's going on, I don't have a fever. That means, and my white blood cell count is not elevated. So whatever's going on, I am not fighting it properly. My body is fighting the wrong things or not fighting it all. Maybe that's the problem. I don't know. So I'm here looking for answers. Everybody's so sweet here. You can't ever be mad here, no matter how long it takes. They work so hard. They work so hard. I will take the opportunity to study. So the nurse practitioner came in and talked to me, and I was just sitting here and I was studying, and then I was also thinking, what are my symptoms? What do I want done? What do I want done while I'm here?
Mary had called her and sent her the pictures, and they were initially thinking cellulitis, but as you can see, my thyroid is all the way swollen out to there on both sides. I see it. So what we're doing, what we've decided is that absolutely we cannot treat this or fix this all right now. What we can do is we can treat the symptoms. And what symptoms am I having? My throat is inflamed. All this through here is inflamed. My strep test was negative. Dang it, that would have been an easy fix. So, possible strep? The answer was no. I was like, I wonder what my white blood cell count, because it hasn't been elevated. My thyroid count, the inflammation I want to check. I'd like to check my blood sugar and A1C just to make sure I'm not going diabetic. I need to get my endocrinologist info while I'm here. I was thinking maybe I needed an ultrasound of my thyroid and throat, and literally that's what she says we need to do while I'm here today. Here are my symptoms, and here are all of my thoughts. Possible allergy complication, and she literally said this could possibly be an allergy complication. Histamine response, interference with immune response. I was thinking I need a white blood cell, red blood cell count, insulin levels, liver enzymes, kidney function, A1C, and ketone check. Yeah, so as you see, literally, I wrote this all down before she walked to the room, and then she just said all of this. So yay, I'm glad she's on the same page with me there. Ever noticed that about me? Right? It's a symptom of Hashimoto's hypothyroidism. No, not hypothyroidism. Stuff I wrote down before she came in. Possibility of clotting issues. I wanted to ask someone that about low mobility due to chronic fatigue. Will IV make a difference? How do I get ahead of this? These are the questions that I want to address. How do I get ahead of this? How do I stop it? What information do I need to accomplish that? Who do I need to see? And who needs that information to help me? And how do I stop moving, firing synapses? They hurt. That's my problem.